As you think about, again, recognizing some of the things that we just talked about, and change can sometimes be difficult, especially in a patient-facing setting. I think people, when they think of technology, uh, forget that there are other aspects of patient care that don't require machine learning for diagnostics, or don't require a Da Vinci surgical arm. When they think of robots, that's what they think. They think
Yeah,
of a Da Vinci
this is
device.
true. Yeah.
As you think about the things that we still need to do as an industry to help ease that transition for greater acceptance of these tools, what are some of the things you think we still need to work on in
I
order
think
to
I
get them
think
over
more
the hump?
I think more than anything, some of the things that we need to work on are the digital twin models and improving outcomes. Okay. If a patient starts to see, okay, I can use this technology and do it the way they say, and my outcome is going to increase this amount, and I'm going to get a better outcome, I'm going to feel better, and I'm going to be healthier, I will have a better patient satisfaction rating. The physicians think at it from that perspective, but there's still some work that needs to be done in building out those outcome models. How do I now treat my patients in a new virtual world, right?
Right.
How do I interact with them when I need to, give them the feeling that they need to have from me, that I have made the appropriate diagnosis. But how do I use this technology that once I have made that diagnosis, we're going to get to the best outcome? And how are we going to record that using this information? And we're going to give that patient the best capable path of getting to, a better way of life. Because at the end of the day, that's where it needs to be.
Right.
We have now technology that's available that will tell us what we like and what we don't like, how well we handle what situation, and what the outcomes are going to be. Applying that along with predictive analytics to things that we know about medicine from the past is going to get us to where we need to be. It's like applying a sixth sense. I don't know, I may have mentioned this use case to you before, but if you get on a plane and the pilot is sitting there, everything looks good, checks out, everybody's seated, all the luggage is loaded, but he turns it off, gets out, walks out on the tarmac, picks up his paper and says, there's something wrong with that plane. I'm not getting in that plane. I'm not going to drive that plane right now because I'm responsible for these patients. And I'm not going in that direction. That's like a sixth sense that person knows that there is something wrong, although the control panels all look correct. But at the end of the day, how well you treat that patient is going to determine the outcome. And so the doctors need to be able to analyze the data that is being now collected and capable of creating digital models that allow them to model what they would suggest would be the best outcomes for a patient that fits a certain criteria, whether they will or will not take their meds. If we know this patient is not going to take their meds, how do we mitigate that risk, to get them to that outcome?
Right.
So I think that's still some of the stuff that really has to be determined and really set up in the end, is the ability to collect the right information and assist the physicians and getting to the best outcomes. So that's one of the things. There's some other attributing factors that we can talk about as we go forward, but I would think that it's a way to an end, to not only bring in more adoption by the patients, but to bring in recognition by the doctors that they're really benefiting from it as well.
Right. Well, and I tend to, and I think most people, that caregiver doctor patient relationship can be a very intimate one, and it's one that there are high levels of trust, and if caregiver doesn't trust that situation, it's just like in an airplane. You mentioned the pilot. If a pilot doesn't feel safe going up, I don't want to go up. Right?
That's me. That's me. So
it's the same thing with your doctor. If your doctor doesn't feel comfortable with it, then you're likely not to feel comfortable with it either. So it's kind of bridging that last bit of hesitation regarding how this technology works and what they can do with it, and how it makes Not only their patients' lives better, but in many cases, their lives better as well. The burden on clinicians is tremendous in terms of documentation and record keeping,
It's
in
insane.
trying to stay abreast of everything that they have to in order to be effective at their job. So when they can see those benefits, I think adoption will continue to pick up speed.
I think so. I think it's going to, and more the technology, at least the ancillary technologies are becoming much more, the devices are coming up to date to
Mm-hmm.
handle the capabilities like we're suggesting with robotics. So at least the ancillaries are going to be there. It's the results that the doctors are going to be anticipating. We have to see, how well they're going to adjust to that and adopt to that. But I definitely see that it is a wave of transformation that's coming.
Yeah. So as we wrap up here, Anna, as Blue Prism looks at this effort, obviously they've had involvement in healthcare for quite some time, but as Blue Prism looks at the way they want to try to impact healthcare in the future, what ways are you as an organization looking to drive acceptance and adoption of this type of technology into the historically very slow to adapt, slow to change healthcare system?
Well, Blue Prism took on a paradigm shift at looking at experts in the industry and hiring experts that have been in healthcare, that know what they're doing. They did that in some of the other industries as well, but in particular here at Blue Prism, they've added expertise in a particular field of healthcare. So we have our combined team of experts over 100, 125 years of experience, between us that have all worked in areas of healthcare. If we're talking interoperability, we all know interoperability. If we're talking, applied ACOs and the credits associated with that, we've been down that road. If we're just talking patient care, we've got RNs and nurses and doctors that are a part of our staff now. So that has been a contributing factor to building out the healthcare vertical to really put focus on what changes can we make in healthcare? How can we impact what has currently been going on? Use this technology to move us to the next level. And I applaud Blue Prism for that strategy and for looking at that. So that has put much more prominent aspect on the digital health experience that you talked about at the very beginning, and in particular of that patient engagement. As we've talked about, how do we engage our patient and get all these tasks done up front, virtual window, before we actually walk into patient engagement where they're engaging with the clinician and using devices right there that are picking up information that the robots are working with. So it's been a dynamic shift in the way that Blue Prism is looking at the world of healthcare in particular, and I'm very excited to be a part of it.
Well, Anna, thank you so much. Again, it's exciting to watch these changes. It's exciting to watch the kind of the tide shift from just back office and into more and more of the mid and front office as we start to engage with patients. And we're looking forward to seeing how we can continue to drive this adoption and these technologies and efficiencies that can be created even further into healthcare. So appreciate you spending some time with me today. Thank you for sharing your perspective. We appreciate it. Where can people find out more about what Blue Prism is doing with healthcare? I'm assuming there's some information on the website. And
several areas. They could speak with your company, Sykes. They are a silver partner of ours, our gold partner, I believe. We do engage with other experts in the industry as well. But you can always find us at blueprism.com under the healthcare vertical. And you, of course, can reach out to me personally at Twomey at blueprism.com.
Wonderful. Anna, thanks again. Have a great rest of your afternoon. And everybody, thanks for joining, and we'll see you again very soon. Take care.
Thank you.